Hello, everyone. Welcome to the month of May Board of Health meeting for the City of Revere. Please stand for the Pledge of Allegiance. So, like I said, this is the month of May meeting for the Board of Health of the City of Revere. I am Dr. Drew Bunker. I'm the chairperson. With me tonight is Viviana Catano, board member to my right. And also for municipal staff, we have Lauren Buck, who's the Director of Public Health, Michael Wells, who's the Health Agent, Director of Inspectional Services, and Paula Sepulveda, who is the Board of Health Clerk. Also in attendance tonight, we have the Director of Six City Tobacco Initiative, Bonnie Carroll, and as well as the Northeast Massachusetts Mosquito Control and Wetlands Management District, Barry Noon, and Director Kimberly Foss, and etymologist Jennifer Svoza. I hope I said those right, sorry. So first part of the meeting, we're just going to review and approve the minutes from the April meeting. So do you approve, Viviana?
I do.
I approve the minutes as well. Second, we're going to have Michael Wells talk about the condemnation proceedings regarding the 85 Jones Road residents.
Thank you, Dr. Bunker. We had a condemnation for a property located at 85 Jones Road. We had a referral from Revere Fire Department on a recent visit to that property for a medical emergency, and it was referred to Inspectional Services for further review. Upon further review of that property, we did make a decision to proceed with a condemnation hearing. After much interaction with the residents and the family of that property, we were able to come to terms with them, and the property owners had listed the property for sale recently, and they do have a signed purchase and sale agreement for this property. It's expected to close on June 30th, and at this time we will not proceed with the condemnation hearing, as the attorneys did send me a signed purchase of the copy and of the purchase and sale.
Great, thank you. So no vote, no proceedings. I think some of the family is here. Thank you for coming. And glad we could settle it outside of having to do the proceedings. Thank you. All right. Next is we're going to talk about the smoking violation. There was a second offense by Parkway Liquors that's located on 190 Revere Beach Parkway. And I'm going to have Bonnie come up, talk about the offense and then the penalty.
On March 9th, 2024 at 3:16 p.m., the second violation happened where a young person under the age of 21 was able to buy a single backwoods cigar. This is the second offense. The first offense was on January 22nd and 23, so less than the 36 months that could start it over. So this is considered a second offense. Therefore, it's a $2,000 fine and a 7-day suspension of their permit, excuse me, to sell tobacco. If there's no objection, we'll begin that on June 10th for 7 days.
Yep, no objection from me.
No objection from me.
Yep, great.
Can I also just add in that the fine was paid by Parkway Liquors on, looks like April 7th of $2,000. And so the inspectional department will post signage, or will give signage via certified mail to the establishment after this meeting.
Great, thank you so much, Bonnie. Yep. Next part of the meeting is going to be the presentation from the Northeast Massachusetts Mosquito Control and Wetlands Management District.
Good evening. My name is Barry Noon, and I'm here tonight with our entomologist, Kim Foss, and our office manager and Board of Health liaison, Jen Sforza. might be jumping on later. She did have a little family emergency. Again, my name is Barry Noon. Some of the people in this room are familiar. I think I know Mike and Lauren. I'm pleased to be here tonight. We're going to go through a fairly comprehensive slideshow, and then we asked that if we could take questions at the end from everybody. So if you have any questions, jot them down, and we'll do our best to answer them at the end of the presentation. And with that, I will let Kim take over.
Good evening. I'm Kimberly Foss, the entomologist, and if you want, you can go right to the next page, please. The next slide. Oops. Okay. So our district uses integrated pest management, which is one of the most effective long-term ways to manage mosquitoes. It uses a combination of methods while minimizing risks to people and the environment. This presentation will discuss the integrated mosquito management techniques that our NEMMC uses to minimize the impact of mosquitoes on human health, including education, surveillance, source reduction, habitat manipulation, biological controls, and targeted insecticides. Next slide, please. We also have a redesigned website that we did last year, well, actually in 2022. It's more user-friendly to residents. We actually added translation services to this winter. On the bottom of the page, users may choose from several options. The homepage buttons are focused on services provided to the residents, such as residential ultra-low volume adulticiding and property inspection requests. There's also an area for spray exclusions. We have our pesticides listed, and it's a detailed list of what we use, their labels and safety data sheets. We also answer questions. There's a tab for frequently asked questions, which provides answers on everything from our catch basin larviciding program to our salt marsh helicopter treatments. And in Revere, we don't use helicopter, but we use other types of equipment that people may see us out there with. It also has a Protect Yourself button, which offers information to residents on how they can prevent mosquito bites and breeding on their property. And then we have a Notify Me tab, an option for residents to subscribe to topics of interest as they are shared on our website and other social media platforms. We also have Facebook. Next slide, yep. Part of our education and outreach follows the state's messaging on preventing mosquito bites by reducing mosquito breeding around your home and the use of personal protection while outdoors. We encourage residents to use CDC-approved insect repellents, and it will say on the repellent itself, it'll say approved, or it'll say for West Nile or for tick-borne disease, but it usually has DEET or something similar to it. And if you don't know, you can always call us or send us an email, and we can help you out with that. Wearing protective clothing or staying indoors when mosquitoes are most active is very helpful as well. And we encourage residents to also mosquito-proof their home by dumping any standing water that is present for more than 5 days, like cleaning bird baths, clogged gutters, pet dishes, and swimming pools or kiddie pools. Make sure all your screens are repaired and trash, recycle bins, tarps, and boats are turned upside down so they don't collect water. Next slide, please.
We also do property inspections. Northeast enacting legislation under Mass General Law, Chapter 252, in conjunction with Mass DPH, allows the district to engage in preventative management and eradication methods deemed necessary within the Commonwealth. Residents or Board of Health may call us for property and site inspections if they are wet areas and lawns, unused swimming pools, ditches, wetlands that have breeding mosquitoes. We can use a larvicide. Board of Health can also call us to inspect unsanitary or vacant properties for mosquito breeding. We also removed abandoned tires upon request, as long as they have no rims. Just want to throw that in there. Next slide.
Rest as thick as me for a while. So surveillance is the cornerstone of a quality integrated mosquito management program. It provides data to support timely and effective control actions to reduce mosquito populations and the risk of mosquito-borne disease. Massachusetts has about 54 species of mosquitoes. We are experienced in all methods of larval and adult mosquito surveillance and identification. Larval surveillance allows us to identify and treat breeding sites, often eliminating the problem before adult mosquitoes appear. Adult surveillance is the process of understanding the population dynamics and species distribution of mosquitoes in a given area. This is a critical factor to determine how to control them and the potential risk disease in a community. The adult mosquito surveillance season begins the second week of May and continues until October 1st. Each municipality has several different kinds of traps, depending on what species or diseases we're looking for. We only collect female mosquitoes, and those are the ones that are sent to the state public health lab for testing, which starts June 1st. Once any community in Massachusetts gets a positive virus notification, all mosquito control districts start submitting bridge vector mosquitoes. Bridge vector mosquitoes are the ones that feed on birds and humans. And they're the ones that are responsible for transmitting the viruses from birds. Birds carry the viruses. Mosquitoes transmit those from birds to humans. The public health lab releases positive results on Thursdays by noon. Used to be on Fridays. We got it to change early, so because what happens is a lot of the Board of Healths aren't open or they close early on Fridays, and we can't plan for any emergency applications. So we got a Thursday delivery date. We then contact the local boards of health and coordinate the appropriate response. In years where virus is extremely active and weather conditions are suitable for response, the Department of Health may extend the surveillance and testing season into October. Next slide. So we are. Most of our traps are designed to capture adult female biting mosquitoes. We use 4 main types of traps for surveillance. We have a CDC CO2 light trap. It uses carbon dioxide, octanol, and light as attractants. Mosquitoes like either breath that's released by humans, heat, all kinds of other different cues that attract them. These traps can attract those using those cues. They're drawn into the attractant and pulled into a mesh collection net, and then once a week we go and we collect the trap. We keep them on ice so that the mosquitoes are frozen permanently, and ID them frozen, and then they're sent to the lab frozen. And that maintains the virus chain. We use gravid traps as well, which is that little, it looks like a tackle box, and it sits on top of this pan of kind of stinky water that we make. It's a hay infusion with some other things mixed in that's very attractive for mosquitoes laying eggs. When they fly into the pan, we collect them into that little net, and those are the ones that are usually collected for West Nile virus. Recently, we added overtraps, which are they're little cups that we set out in places with papers in them, and that's to attract a mosquito that is new to Massachusetts, and it's invasive from the south part of the country, and it can bring a lot of other diseases, so we're tracking the colonization of that species in Massachusetts, so we use those traps on occasion. You can switch slides. And down here, we don't use them, but in most of the other parts of the district, we do. These are resting boxes. They're used to collect a mosquito that's responsible for the transmission of eastern equine encephalitis. And they're mainly in red maple swamps and a lot of these kind of acidic peat bog environments, which there aren't any in Revere. So, but we still, you know, once we get triple E, we start sampling for bridge vectors, because the bridge vectors, the birds can have it and still move it around. So we may not use these here, but we're still actively sending a lot of mosquitoes, different kinds, for testing. Next slide, please. And in the event of a positive, it doesn't matter which virus, we place supplemental traps out in the municipalities, because we have historic trap sites. So every town that we have has a historic trap. It doesn't move, it stays there, and that way we can look at seasonal populations, yearly populations, and kind of we don't like to make predictions, but it allows me to see what might be coming up in the next couple days or in the next couple weeks based on epi weeks. When we get a positive, we set out supplemental traps, in our other areas. So the historic trap stays where it is, and then we set these supplementals in other places, and that we can use to find out if we're getting any mosquito disease in other places, so we can treat appropriately. They're also used to pre- and post-monitoring of our adulticide efficacy. So a lot of the times, once we do an adulticide event, we'll place a trap out to see what we get for mosquitoes, to see what our percentage of efficacy is on the application that we did. And then for equipment, security, and resident privacy, we don't disclose the locations of any of our traps to the public. The local boards of health can request that confidential information from us, and we ask that once we give it, that it's not released either. Next slide, please. Another vital part of our integrated mosquito management is physical control through mosquito habitat mitigation and manipulation. We have specialized low ground pressure wetland excavation, mowing, and earth moving equipment. Last year, the district cleared over 23,000 feet of impacted stormwater ditches, and we cleaned out about 57 culverts. Clearing these either by hand or mechanically keeps stormwater from backing up and creating stagnant areas where mosquitoes can breed. We also have worked on large salt marsh projects, and those can dramatically reduce mosquito habitat by providing deeper pools for birds and fish, and ditch restoration projects provides better drainage of tidal water. The district has removed and disposed of used tires through petition wetland management projects, coordinated cleanups, resident requests, scouting, and participation in household hazardous waste events. We remove anywhere from 600 to 800 tires a year. These practices are considered an important part of the district's IPM approach and have become a valuable vector mosquito habitat management tool. Through our invasive plant protocol, we mow large areas of Phragmites. This is a tall, dense aquatic freshwater and brackish water plant that provides breeding habitat for several species of mosquitoes of viral concern. It also provides shelter for large populations of resting adults. Mosquito control efforts may be inhibited by dense stands of Phragmites, either by preventing the adulticiding from reaching the spots we're needing to treat, or the availability of us actually accessing the site. It's so tall, it's razor sharp, it makes it almost impassable to get in there to treat. So every year here in Revere, in the fall, we mow it down. So first thing in the spring, we can go in and treat all these salt marsh areas with a larvicide product that lasts a long time before the Phragmites gets up to a height that we can't treat them anymore. Next slide, please.
Next, I'd like to touch on our general larviciding program. Larviciding is the primary chemical approach to mosquito control when habitat mitigation isn't an option, and it's also the most efficient way to kill mosquitoes before they ever hatch and fly. The district keeps a database with historic larviciding sites, which include spring snowmelt areas, woodland pools, pastures, floodplains, lawns, swamps, and salt marshes. Larviciding begins in March, or as the snowmelt allows, until usually the end of September. Our field teams go out to each site and dip multiple times for larvae. Some samples are brought back to the lab for species identification. Sites may be treated by hand, backpack, mechanically, or aerially. Not all of these sites require treatment. There are predators present, such as fish, frogs, where we will not treat that site. Freshwater spring snowmelt sites, abandoned swimming pools require one treatment per year. Salt marshes, summer floodwater sites, ditches may require multiple treatments within a season. On that slide, the dipper to the left is a pre-salt marsh larvicide treatment in one of the historical pools that we find. There's thousands upon thousands of mosquito larvae in there. And then after treatment, we go back out to the same sites and record what we find, which is quite a big difference. The mosquitoes are not eradicated, but reduced to a more manageable level. Next slide, please. Next, I'd like to touch on our catch basin program. Our catch basin program is designed to reduce the seasonal risk of West Nile virus in urban sites. Culex mosquitoes are the primary vector for West Nile virus. Catch basins, like tires and containers, are their preferred habitat. So timing the treatment of basins is critical. Annual treatments can also have a cumulative effect in reducing the total population into the following year by up to 80% compared to untreated catch basins. We do reach out to municipal DPWs and assist them in efficient treatments of catch basins by scheduling annual cleanings either before or after, in which helps us decide what chemical we're going to use for the season. Cleaning reduces organic material in the basins that allows for greater efficacy and bacterial larvicide treatments. Next slide, please. Oh.
All right, I'm going to talk about larvicide products. So all the products we use are EPA registered Category 4, and the Category 4 means it's low to very low toxicity to the environment or people, or animals, pets, children, birds, anything but our target species. We use bacterial biolarvicides, which could be Bacillus thuringiensis israeliensis or sphericus. Those are bacterial. They're specific for mosquitoes and black fly larvae. We don't treat black flies here, so we're focusing only on mosquito larvae. We also use methoprene, which is a growth regulator. What happens with methoprene is it's ingested by the mosquito larvae, and then they'll continue their development as juveniles. And before they pupate into adults, they don't make it. So, and we use that product when we have certain areas. We only use methoprene in containers, so catch basins, swimming pools, things like that. And we'll use that product when it's really dirty, because the bacterial product, the mosquito larvae ingest it as well. And it doesn't work as well if there's competing organic material. So that's why when we reach out to the DPWs to clean the basins, they'll clean them, and then we can use bacteria. If we get to them and they're not cleaned yet, we use methoprene. And methoprene works, it doesn't compete for the mosquito's food source. We also can use a liquid mechanical suffocant. It's like a coconut oil or mineral oil. It dissipates in 4 to 5 days. We use those for pupae, because pupae don't feed, so the only way to get to them before they emerge as adults is to put a layer on the surface of the water, so it actually physically suffocates them. And then it biodegrades by UV sunlight, or bacteria will eat it within 4 or 5 days, it disappears. A lot of these products, too, we use on a rotational. So like methoprene, we don't want to use every year. We might skip a year or two, and then we have a lot of these other products that are listed, different formulations, different percentages of different products. Sometimes there's a blend of the products, so we'll rotate all these products to make sure that we don't get any mosquitoes that become immune or unaffected by the product that we use. Next slide. It's up to you to talk about that.
So when we can't kill the larvae, we have to attack the adult flying mosquitoes. We deploy ultra-low volume truck-based adulticiding, usually coordinated with the boards of health or in towns and cities where residents are allowed to call in. One advantage to the ULV applications is only the very minute amounts of pesticide that are dispensed over a large area. About 1 ounce of mixed product is applied per acre, or about 1 millimeter of active product over an area the size of a football field. To protect pollinators and bees, adulticiding operations are only completed at night, and we start 30 minutes after sunset. We also have onboard weather stations on all the trucks, so we can know humidity, temperature, wind, and we also have GIS mapping with endangered species layers, resident exclusions with warnings, so all of our field techs know where they should be going and where they can't be using adulticide. The product is highly effective. It provides a quick knockdown with reliable control at flying mosquitoes only at time of application. There is not a residual, meaning the product does dissipate fairly quickly. And as a reminder, especially on the coastal towns, salt marsh mosquitoes fly and bite during the day. They rest in thick vegetation at night, so sometimes the nighttime applications won't control these mosquitoes a lot of the time. And again, adulticide applications will be canceled if temperatures drop below 50, if it's raining, or wind speeds excess of 10 miles an hour. And that's all due to the label of the products. The label's the law, so we can only follow what those labels tell us we can do. To reduce, next slide, I'm sorry. To reduce the need for repeated applications, we do recommend barrier treatments. We have done those before in the city of Revere last year. They worked out really, really well. These are usually used in high public areas such as public fields, schools, parks, and athletic fields. The barrier treatment is a residual microencapsulated product applied to a physical border such as trees, fences, outdoor structures, and such. To protect bees again and other pollinators, barrier treatments are completed only at night, 30 minutes after sunset. Reentry to treated properties is usually good when the product dries, usually in the morning. And on all school properties, we always post a sign of when the application was done. Let me see. All right, next slide, please. We do take Board of Health requests for adulticiding. We followed our phased response to virus protocol to reduce the risk of West Nile and Tripoli in human infections. We do recommend selective and targeted adulticiding applications when virus-infected mosquitoes are discovered. Only the boards of health in our member municipalities can request adulticiding and barrier treatments for schools, recreation areas, publicly owned municipal property. We do have a lot of residents who are like, oh, I was walking my dog in the park. I want you to spray the park. And I'm like, well, you can't do that because you don't own the property. We have to talk to the city or town and get the Board of Health approval to do so. This year, in the best management plans that we sent out to all member municipalities, include a new checklist or a reminder for boards of health, tasks that can be completed early in the season, such as scheduling barrier treatments and contacting IPM coordinators to update their plans to make sure they have our latest product. And I've already been in touch with Hajar this year about scheduling that for the city. Next slide. The school IPM program is very important. For us to ever even go on school property, IPM plans must be updated by the IPM coordinators. Every spring, we send out a list of our newest and up-to-date products. I know that Revere, we did that a couple years ago. We brought everything up to snuff, so almost every school in the city, I think, meets the newest products that we do offer. We do this in coordination with the Child and Family Protection Act, which requires a school IPM to list pesticides that are going to be applied on school grounds. Schools must include mosquito control in their outdoor IPM plans if they intend to request services. If the IPM plans don't list the products we use, then we cannot treat. We have a great relationship with the IPM program for the state of Mass, and can easily get schools updated in an afternoon, which we've done before, and they've been very, very helpful. Next slide. Residential adulticiding requests. Not every town in the district, which we're made up of 32 different cities and towns, allow this. Revere does for their residents for good reason. Residents need to request their own property weekly as needed to control mosquitoes. They cannot request their neighbor, their uncle. They really have to live there. We run into this a lot, I think, with the new updated website by entering an email. Allowing permission on the premises has kind of streamlined this a little bit. I think a lot of the education that the city of Revere has done along with us guiding people to our website, has really transformed the way we interact with the public the last couple of years, so I applaud the city for that. When residents request adult deciding, we only use truck-based treatment applications, and what that basically means is we back into their driveway, we stay on solid ground, we turn on the machine, and we slowly pull out and shut off and leave. When that sprayer is on, it puts a column of spray that can go up to 300 feet wide and probably like 150 feet back. So even though we can't get into the back lawn, we're pretty sure that it's going to go behind the houses, and a lot of the houses are pretty shallow here in Revere. With that being said, the onboard weather stations and the GIS tracking systems we have do allow us to make sure that we're not spraying someone on the other side of the street who may be in exclusion or anything like that. Next slide, please. Residents who request exclusion of their property must comply with the legal process to do so. Private property owners may request exclusion from wide area applications or pesticides on their property by the district. If a tenant is requesting the exclusion, the landlord contact information must be included, and the landlord can override this request. Each property owned needs a separate exclusion to be filled out. Exclusions cannot be completed for public properties by residents. This procedure excludes the entire property from adult deciding and larviciding. Residents must be made, I'm sorry, let me start over there. Residents must be made aware that the Massachusetts Department of Agricultural Resources will go into effect 14 days after the date of the request is received. All exclusions start on January 1st and expire on December 31st. The exclusion requests may be accessed either at our website or directly from the MDR website. And we do have a button on our website that brings residents directly to that. Next slide, all right. So this is a timeline of our activities. A lot of people think we just kill mosquitoes during the summer and don't do anything else the rest of the winter. That could be further from the truth. We do year-round mosquito control in source reduction efforts with our special low ground pressure equipment. We're always trying to get the water moving. We have many areas that we work closely with DPWs, residents, and the boards of health who find these areas. So the timeline above is kind of a breakdown of what the district does all year long. And with that, if there was any questions, me and Kim would be happy to answer.
I do have some questions. Thank you so much, Kim and Barry, for this great presentation. I have a question for you. What recommendations do you have for people who are keeping rain barrels in their property?
A lot of times you can buy, they sell mosquito or insect covers, like with mesh or screen, and you could put that over.
Okay. And what if you have like those containers that are self-watering that usually have like a little thing in the bottom so that the plant can suck up the water? Is that a concern?
I mean, yeah, you can get hundreds of mosquitoes breeding in a bottle cap. So, I mean, if they just dump it every once in a while, refill it with water, you know, it's just kind of waiting the 5 days is not good, because any little water sitting there, you know, they'll lay the eggs and they get glued to the side of anything. And then when it refloods, the eggs hatch and then you have larvae in there. So just by dumping it, it kind of keeps the water fresh, you know, so it's not stagnant and full of nutrients that the mosquitoes can breed in. So all it takes is you can just look and see, and if there's things wiggling in it, dump it, and then you can refill the water. So, or the screening again.
Thank you. I have three. So one
That's okay.
second question. it sounds like residents can request an inspection and then a spray. And my question, would a resident have any hesitancy if they call you guys to do an inspection for mosquitoes? Maybe they're nervous, maybe there's something they know, maybe they're not in compliance with the city. Would you guys be looking to see if they're violating other things, or do you guys just kind of go in there with your mosquito
So we are
focus?
only mosquito-based. We are
Okay.
not enforcement. We are not an enforcement agency. So unless the Board of Health asks us to go to a residence to check for a public health risk, then we'll do a full report. But other than that, if a resident just says, hey, I think I have breeding on my property, or can you come help me and pick out, anything, tires, whatever it is that they have, we'll just go and then we fill out a card after we're done. If we see something that might need to be treated, we'll treat it. And then we fill out a door knocker that we leave so that they can read and see what the result was when we went, but we're not enforcement.
Okay. And finally, so it sounds like your products are as safe as they can be for human, pets, pollinators. Is there any reason why any particular resident should not be calling to get this service? Like if you have a child with asthma, or is it really safe for anybody? There shouldn't be any concern?
Yeah, I mean, we take into account for every situation that we can. I mean, each one is done on an individual basis. So if it's an abandoned home with a swimming pool, we may use a longer lasting product that, probably works better, but there's no people there. So we can really, use what we need to use in that swimming pool and then tell you guys that, but with a resident, we may more likely dump something or, just take the dish, turn it over, flip it over, or grab the tire that's on the lawn and take it with us. If we notice screening that could be repaired, things like that. We do a full write-up when we do an inspection.
Oh, okay, so it goes beyond what Barry was saying, which is coming to your driveway with the truck and spraying. You do a number of other things?
So there's two different things, and this is probably where, so larviciding or service request, we have, when you get up the screen, there'll be 3 boxes. There's larviciding or an inspection. So we go and we're looking for young mosquitoes, ones that aren't flying yet. When there's an adulticide request, that's where we use the truck. And we don't check the property, it's dark. We come, we spray, we leave. If it's a tire request, they can check that box and we go pick up the tire. So it's the inspection, the larviciding inspection. That's when we go on the back and we go during the day and we check things for mosquito breeding and let them know that what they can do around their property to alleviate that, or we treat the site with a bacterial product, only bacterium, at residences.
Thank you so
where people
much.
live.
Said it all.
I have a couple questions for you guys too. I know some of these answers, but I want to kind of get them out to our viewers listening at home. So you can imagine that there's sometimes novel ideas on the news or on the internet about how to kill mosquitoes, and I want to talk about 2 that come up a lot and maybe why you don't see them around Revere. One thing that always comes up and we sometimes get questions about is for the Phragmites, using goats to eat them. This kind of comes up a lot, and why don't we do that? The second thing that has come up a lot is, and I talked to you about this last year, Barry, but again, I just want to get it on record, is dragonfly boxes. So could you guys talk about those 2 techniques and why they're not necessarily used here or effective here?
I mean, dragonflies can eat mosquitoes, but there's a lot of things they like to eat that's better. And then the other thing is when you get dragonflies, sometimes they're shipped and ordered from other states, which they're invasive. So when they're brought here, they end up destroying our native dragonfly species. So we tend not to want to have them bring in any organisms from other states. You shouldn't be doing it. Our native populations, they do, and in those areas where we have ponds and things that are frogs and dragonflies, we don't have to larvicide those areas because there's a little niche and they take care of everything all on its own. Most of our larviciding is done because of containers, humans. So, or roadside ditches or stormwater, things like that. We get the same questions for vernal pools. We don't treat vernal pools, with eggs and frogs and salamanders. They don't hardly have any mosquito larvae. The pool next to it might have 600,000 mosquito larvae, but it doesn't have any frogs or dragonflies or anything. And then it's like the bat question, bats eat mosquitoes. They really don't eat a lot of them. You know, they're bats are bats. They'd rather have a hamburger than a French fry. So, you know, they'd rather go after really large beetles and bugs rather than try to fly through a swarm of mosquitoes or a single mosquito. So it's good to ask those questions, but yeah, we don't really care for the bucket biology, bringing things from other states. You know, that does, you know, kind of create huge problems environmentally when you do that, so.
I appreciate it. You want to talk about the goats, maybe?
I'll talk about
Yeah.
Oh, and the goats, yeah, go ahead with the
I think, I've seen goats not used in Revere, as many other municipalities as well. I just think that the Phragmite plant is too thick, too strong. It's almost like bamboo.
and too fast.
And it grows too fast. When we come in and mow, we bring it into a pulverized pulp. Takes longer to grow back in that case. And another reason, we started out mowing Revere for fire break for something that happened 30, 35 years ago, and I think it's worked out well since then, so we don't have any neighborhoods burning down. On top of that, we realized that if we go in there and we mow in October traditionally, it stays dormant all winter long, and then as soon as the spring starts, it starts to grow again. By the end of June, it's usually 3 feet tall. By middle of July, it can be anywhere between 10 and 16 feet. We found in a lot of the 8 areas we go into in the city with the machines that they're prime salt marsh solicitan breeding. And so we realized we go in there with our specialized tracked equipment to put out that granular that Kim was talking about that gives a longer lasting effect.
Sometimes up to 2 months,
Yeah.
or 5 to 6 refloods.
Yeah.
So.
But I think if we could get into those areas in the future and do some source reduction, some digging, we could work with the DPW, with the boards of health. Those areas would actually breed less. The frag would actually then be in competition with the natural plants that are in the salt marsh and maybe begin to recede a little. But the Phragmite is a heavy-duty plant with deep, deep rhizomes that does not give up easily.
Thank you so much for explaining those questions. That will also help us when residents call and talk about that. Last thing that I wanted to talk about is we will hopefully be doing 2 barrier sprays again this year like we did last year. So again, any of our residents listening at home, that means that we will be doing a barrier treatment to our schools, our parks, our fields. And so there's going to be signage posted 2 times this summer. But I just want to reiterate again what Barry and Kim mentioned is that, you know, for the night that we do the spraying, obviously we don't want anyone on the field. And then when, you know, practice resumes again the next morning, all the kids should be okay to practice on the field without any worry from the parents, correct?
Absolutely.
Thank you.
That's it.
Thanks so much, guys, for being here.
Thank you very much.
All right, the next topic of this meeting is going to be the Public Health Communicable Monthly Report from Lauren Buck.
Thanks, Dr. Bunker. So for the Public Health Communicable Disease Report for this month, it's actually incorporating 2 months worth of data because I wasn't here. So the report runs from March 28th to today. I just want to highlight a couple things. The hepatitis B line item that you'll see, we have 3 confirmed, 3 probable, 32 suspect over the last 2 months. That's an unusually large number. I just want to talk about it because myself and the other public health nurse from Revere have kind of been investigating why we had 32 suspect hepatitis B cases. There's no cause for concern. None of the cases seem to be in any cluster or anything like that. What we think potentially is happening is that most of the suspect cases that we see come through MAVEN, which is the disease reporting for the state, is a software program for the state. We think most of these are people who have already been known to have hepatitis B and just got retested for some reason, potentially had some blood work done. And so we don't think that number is a cause for concern at this time. Obviously, we keep monitoring everything on a daily basis. And if there's anything that we see concerning related to hepatitis B, we will continue to let the Board of Health know. You can see that our influenza case numbers are, 115 confirmed cases over 2 months of influenza. For COVID, we had 59 confirmed cases, 6 probable, 2 suspect. Again, we're reaching the end of our concerning season for flu and COVID, but it's definitely still out there. I think these numbers obviously are a major underestimation of what our flu and COVID numbers actually are. I think many people either don't get tested anymore, especially for COVID, or test at home using home tests. But just another reminder that anyone who is immunocompromised, super young, super old, just needs to continue to be super careful. But we are reaching the end of the risk season for that. And then I just have a couple of updates from the CDC that I wanted to make you aware of. As of May 22nd, so yesterday, a human case of highly pathogenic avian influenza, or this is the H5N1 bird flu that has been on the news a lot lately. So I wanted to talk a little bit about it. So a human case of the H5N1 virus in the United States has been identified in the state of Michigan. So it's a human case. This is the second case associated with an ongoing multi-state outbreak of H5N1 in dairy cows. As with the case in Texas, the individual is a worker on a dairy farm where H5N1 virus has been identified in cows. Also like the case in Texas, again, this is a case in Michigan, also like the case in Texas, which was the first human case, the patient only reported eye symptoms. There have been no signs of unusual influenza activity in people in affected states otherwise. And so based on the information available, this infection does not change the CDC's current H5N1 bird flu human health risk assessment for the U.S. public, which the agency considers to be low. However, people with close or prolonged unprotected exposures to infected birds or other animals are at greater risk. Secondly, I just wanted to update the CDC, the public about a May 14th report from the CDC that showed that drowning deaths are actually on the rise in the U.S. following decades of decline. This is according to a new CDC vital signs study. Over 4,500 people died due to drowning each year from 2020 to 2022, which is 500 more than compared to 2019. Groups at higher risk saw the greatest increases in drowning deaths, and those groups are children from 1 to 4 years old, adults over 65 of all races and ethnicities, as well as Black people of all ages. Drowning is the #1 cause of death for children 1 to 4 years old in the U.S. Everyone can help prevent drowning deaths by learning basic swimming and water safety skills. Children who have had swim lessons still need close monitoring and constant supervision when in or around water. You can also prevent drowning deaths by building fences that fully enclose and separate the pool from the house. Fences should be at least 4 feet high with self-closing and self-latching gates. Wearing life jackets while boating for people of all ages and all swimming abilities. Not drinking alcohol before or during swimming, boating, or other water activities. And finally, learning CPR. So just a warning, obviously we're coming into pool season. Just make sure that you're following those guidelines from the CDC. And lastly, from May 16th, this was actually an information from Boston.com that was reported from a CDC study that showed fatal opioid overdose deaths in Massachusetts have decreased by over 10% in 2023, marking the first annual decrease in 4 years. This is preliminary data from the CDC. The state's Department of Public Health said it continues to invest in harm reduction programs like expanding access to naloxone, fentanyl test strips, and sterile consumption supplies. Just in 2023, more than 262,100 naloxone doses were distributed through community-level naloxone distribution programs, and more than 9,100 overdoses were reversed using the medication. Just another highlight here that, as we talked about 2 months ago at the Board of Health, that the city of Revere will be getting naloxone or Narcan boxes installed hopefully in the next month around Revere. This is a life-saving medication that can help reverse opioid overdoses. And Revere is also part of the community-level naloxone distribution program, and we regularly distribute naloxone to anyone who has recently had an overdose and their families. And if you are in need of naloxone, please call our office or call 311 and ask for the Public Health Department, and we can definitely get you naloxone. Thank you.
Great, thanks, Lauren. Next is going to be the Inspectional Service Monthly Report with Michael Wells.
Thanks, Dr. Bunker. Inspectional Services Monthly Report for the month of May. On the Interior Housing Division, we performed 171 certificates of fitness. This number is very high this month for a busy month with the Housing Division, as this pertains to the Suffolk Downs community, the new residential building coming on board with occupancy. We also performed 16 certificate of fitness re-inspections, 8 interior complaints, 2 interior complaint re-inspections, 4 pool inspections, 9 pool re-inspections. On the food inspection division, we performed 31 routine inspections, 7 re-inspections, 5 complaint inspections, 1 pre-opening inspection, and we had 1 establishment closure. On the exterior sanitation division, we issued 53 violations for accumulation of litter, trash, and debris on the property. We issued 305 violations for improper placement of garbage and trash, 2 violations for multiple unregistered vehicles on the property, and 77 violations for unclean, unsanitary land, which is mostly for overgrowth. One of the things I would like to stress, as we do in the winter with the snow and ice removal, we're at the time of year where we need to reiterate the fact of overgrowth and unsanitary land. Urging the residents to take a look at their property to ensure that they're maintaining their grass, keeping it low and maintaining it on a weekly to 10-day basis to ensure that we're not harboring rodents and mosquitoes that we just talked about as well. So it's important to ensure the overgrowth is staying low. And we issued 1 violation for working without a permit. That concludes.
Great, thank you, Michael. Next was we're going to talk about licensing. Have Lauren do that.
Thanks, Dr. Bunker. We just have 3 licenses for your approval today. We'll start with a new chicken keeping license. This is submitted by Carmela and Luigi Di Dichara. They're at 28 Malden Street. We did their inspection on May 16th. They did pass. I want to talk specifically about two situations that we had with this property. We are recommending you approve this license, but I just want to make sure we're on record. In the regulations for chicken keeping, we do have 2 requirements that this property is unable to meet. One is that someone would only keep chickens in a backyard, not on a front or side yard. This property does not have a backyard. It only has a side yard and a very steep front yard. And so because of the way the property is set up, the side yard functions as their backyard, first of all. And second of all, is pretty removed from the street level, very removed from the street level. It's much higher. The second requirement that they don't meet is that there's a requirement that all coops and runs be set back at least 5 feet from the side property line. This is not met on this application, and it is because they had pre-built 2 shed structures that they were using as a kind of a divider, or they were using that as kind of the basis of where they're putting their coop and run. And that is pushed right up against their side property. Part of the requirements as well make our applicants visit their neighbors and have the abutters sign to make sure that they're aware that they're going to be keeping chickens there. Mike and I talked about both of these requirements for this specific property and still recommend that you approve the license. The neighbors are aware that they're keeping chickens and they have signed off. Obviously, if there's a change of property for the neighbor, we would need to reassess. And also the side yard situation is really so removed, and it's really not on any sidewalk or anything like that, that it feels very similar to a backyard. So I just want to make sure that you're aware of those 2 recommendations. And again, they did pass their inspection with those 2 caveats, and we still do approve that, we recommend that you approve this license.
Yes, I approve the license.
Yes, I approve the license.
Thank you. The next license is another temporary license for a body art establishment and an individual practitioner. Last month, you approved a temporary license for an event at Boston Harley-Davidson for a tattoo artist, David Martinelli. The event was very successful, and Boston Harley has asked for him to come back for a summer series. Because of the more, it's a pop-up temporary event over a couple of pop-up events over the course of the summer. But because it's not just one singular event, we went back and did a re-inspection of the site. We asked for some additional protocols to be in place because of the more permanent nature of this. However, it is still temporary. Just a reminder that David Martinelli is already licensed in Danvers and holds a license with that city. And so he is going to be operating out of Boston Harley-Davidson over the course of several weekends throughout the summer. And those are starting in June, every other weekend, June 8th, June 9th, which is one weekend, June 22nd, 23rd, July 6th and 7th, July 20th and 21st, August 3rd and 4th, August 17th and 18th. We have gone through both at the establishment and with David as an individual practitioner, all of the same questions and requirements of a established, permanent spot here in Revere. There are a couple of things that don't necessarily apply because it is so temporary. But we do recommend, and again, we did the inspection on May 21st for both the establishment and the individual practitioner. And we recommend that you approve the license for both the establishment and the individual practitioner for the dates that I already mentioned, for both Boston Harley and David Martinelli.
Yes, I approve of both.
I approve of both as well.
Thank you.
Great, and that will conclude this month's Board of Public Health meeting. Thank you.